The Chair of the Health Committee would like to call the Thursday, March 7th, 2024 meeting at the Health Committee to order. We have 4 members present. Member Byrne and members Went are absent. We have a consent agenda. Do I have a motion? Motion by Johnston, second by Hanson. Any discussion? Hearing none, all in favor? Aye. Any opposed? Okay, we have approved that. Do we have any members of the public?
Chair Schaefer, we've had no request from the public to speak this evening.
Thank you. Moving on to departmental matters, first we have Jason Tabb, Juvenile Detention Superintendent.
Good afternoon. I have no action items. You have my report in front of you. If you have any questions, I'd be happy to answer those.
Any questions for Mr. Tabb? Okay, then thank you very much.
Thank you.
Next is Diane Hughes, Jail Superintendent.
Hello, I have no action items either, except I would like to introduce our new Health Service Administrator, Lana Strum. She will be taking over. Cassie Alexander is here as well. She is helping train her for advanced correctional health care. And then Jackie Mathias is here as well if anybody has any questions for her.
Okay. Anybody have any questions of Diane or any of the jail staff? I do. I'd like Jackie to maybe talk a little bit about MAR and also restoration too, and how that's been going.
Okay. For MAR, we, as you know, have the ILMAR grant, the Illinois MAR Learning Collaborative Grant, so we've received some monies to help us with that. We are very new with our MAR program. We just started it in July of 2023. Currently, we have 7 people in our MAR program, kind of at a little bit of a standstill while we get reset up with our provider again. Thankfully, Dr. Duran with ACH has been willing to keep everyone who's been on it. She's kept them going on that, but we're not doing new inductions until we have our specified provider. We also work with MAR now so that those, when they're released, we're still able to make sure they get their prescriptions, be able to get hooked up with services in the community. And we've been able to do that for the 2 that have been released during this interim time. So that has been very helpful as well. We also have started substance use disorder groups. So currently they are wrapping up we have 2 of them. One's a substance use disorder, kind of learning about the disease of addiction and kind of identifying those things. And then the relapse prevention group is starting next week. So it's kind of a back-to-back. They go from one group to the next group. And we have that for men and women, both. So, and currently, my case manager is midstream in her studies to be CADC certified. So we will hopefully have an addiction counselor very soon, in about a year probably, by the time she gets through everything. So with our MAR program, we have a TCU, the Texas Christian University opioid validated screening tool that we use on everyone that comes in when they come in to custody. We start with that. Also, we go with self-referral, so anybody who puts in a request to us, we will go and meet with them, get background information, get as much as we can, and work from there on whether or not a referral is appropriate for the MAR program for medications. Everyone is open to have the counseling services available. If they are referred, then our provider does a full assessment, and the provider is the one that decides whether or not and what medications are appropriate for them to have. So, is that it? I don't know. It's a very brief overview, but yeah, we're still very new in it as well. On restoration for those that are found unfit to stand trial, we don't really have like a formal process. It is more something that we've been able to increase over the years, I would say. So the restoration process mostly starts with our staff, that's corrections, that's us, that's healthcare staff, all encouraging our incarcerated persons to participate in treatment, take medications, in any way we can help them. And then once we can get them taking medications, keeping them stable and consistent with that, and then working with them on counseling. Dr. Lynette Smith is the DHS placement specialist that comes to our county. So I collaborate with her on a regular basis. So if we have someone that we feel is probably getting close to, being at a level they may not need to go to the state hospital, she comes to our facility and does a reevaluation. So I have somebody actually she's seeing next week that we're hopeful will come off that list because he's been doing really, really well and actually moved out of our special needs unit to the general population pod a couple weeks ago as well. So, so it's not a formal process. It's just we will do everything we can to try to encourage and get that going. And we're in constant contact with them to kind of reevaluate ourselves. We're not the legal experts. We can't make that happen, but we definitely will make recommendations when we feel like somebody's reaching that point.
Do you think that the ones that have participated in that will maintain?
I always hope, but yes and no. I think that with some that we see as repeat customers, so to speak, the ones that are coming in and out a lot, unfortunately, that's a cycle that they're in, and just convincing them that stay on those meds is difficult. We have seen successes, though, of people that don't come back, or we hook them, they become fit, they're then moved to recovery court, or they move to other treatment options. And then once they have that community engagement, we don't see them as much. So, but usually if we can get them engaged in the jail, at least while they're in our custody, probably like 7 times out of 10, we can keep them kind of consistent with us.
Great, thank you. Anyone else? Okay. All right, thank you very much. Next up is Jessica McKnight, Health Department Administrator, and you have items for action. And if the committee does not object, I would like to combine 4C1, A, B, and C, since they are cleanups for 2023. Okay, so 4C1A is request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2023 combined annual appropriation and budget ordinance for Fund 105. 4C1B is request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2023 combined annual appropriation and budget ordinance for Fund 106. And 4C1C is request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2023 combined annual appropriation and budget ordinance for Fund 110. And do I have a motion? Motion by Hanson, second by Johnston. Any questions? This is just the end of the year cleanup. So, okay, all in favor? Aye. Any opposed? Okay, those are approved. The next item is 4C1D, is request approval of an emergency appropriation ordinance amending McLean County fiscal 2024 combined annual appropriation budget ordinance for Fund 112. I have a motion by Johnson, second by Knapp. This is, I'll let you.
So this is amending the 2024 budget for projects that were approved in the 2023 budget that we weren't able to complete. So painting of our clinics and waiting room furniture for the clinic areas.
Okay, any questions? Hearing none, all in favor? Aye. Any opposed? All right, that one is approved. You have your monthly report.
I do, and it was the Environmental Health Division that was spotlighted, so I'd be happy to answer any questions about the report.
Questions? See, if I hadn't asked Jackie all those questions, we would have been done in 5 minutes. Okay, hearing none, thank you. Next up is Tim Wiley, Nursing Home Administrator. Oh, you have an item for action. For whatever. D1A is request approval of a skilled nursing facility inpatient care services agreement with Loving Peace Hospice Incorporated, DBA Gentiva. Motion by Johnston, second by Hanson.
This is simply additional services. We're already contracted with Gentiva as a hospice provider. This is just a contract for us also to work with them on just respite stays.
Any questions? So how many hospice providers do we have now?
I believe we're up to 5.
Okay. Thank you. All in favor? Any opposed? And that one is approved. And you have your monthly report.
Yes, just a couple things to highlight. First of all, in the month of January, we were able to serve 30 hospice residents in our neighborhood of Serenity Lane. That's over 20% higher than we've ever been. We were excited about that increase. You'll note also agency utilization had an uptick, but we had a COVID outbreak, and had several staff out with COVID, so that accounts for that uptick. And then regarding the mechanicals and infrastructure project, we have completed the RFQ and an engineering firm has been selected. We're excited about that. And then one other item you'll notice in the referral section, our closing rate actually hit 96%, which was very exciting for us. Other than that, if you have any other questions, I'm happy to answer.
Member Johnston.
Thank you, Mr. Wiley. As always, your reports are very thorough. I noticed that this, for the January month, that we did quite well, but it felt like expenses were really low. Can you talk about that a little bit? Because, I mean, I would love to see the 350,000 surplus every month, but it felt like expenses were low this month, or that month.
So I included in there that that's the result of end of the year budget accrual. So a lot of the actual expenses that would have been paid out in January, or that were paid out in January, and actually some that will be paid out in February, got accrued back into December. So it makes the number look lower than usual.
Okay. And then the other question I had was about our Serenity Lane. Are we nearing capacity, or is that a 50 wing?
It fluctuates.
Okay.
Actually, if we were able to maintain serving around 30 people a month on there, we would be in a fairly strong position.
Okay.
Our primary goal is to get to what we refer to, or what the industry refers to as general inpatient, to where we are getting reimbursed by Medicaid more like a hospice provider. So that's where we're hoping to land in the near future. We're moving in that direction. It just, RN staffing right now is what's holding us up.
Okay. All right. Thank you.
Anyone else? I have a question, kind of goes back to what was the other question that Member Johnston had on the treasurer's report that we have from, and I think that's what you were looking at. So then the report that the treasurer gave us that had the year-to-date on December, is that more accurate as to what the entire year was? Or is it still, are we still going to have some more things accrued back to December?
It is my understanding that that's very close to what the numbers are actually going to look like. I received an email today just stating that there are maybe a few items yet to trickle back into December, but it shouldn't be anything significant.
So that's good news, right?
I believe it is good
Okay.
news, yes.
I mean, it's a loss, but it's smaller than last year. So it's definitely showing the improvement on the payer mix and the number of residents that we have there on our census, so,
Yes,
and controlling expenses.
yes.
So I think that that's really great, in the direction we're going there. So, anyone else? Okay, thank you. And next up, we have Cassie Taylor, County Administrator, and you have an item for action.
I do. Thank you, Chair Schaefer. I have one item, which is the request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2023 combined annual appropriation and budget ordinance.
I have a motion. Motion by Johnston, second by Knapp.
And this is end of year cleanup for any departments under this oversight board's purview outside of the health department.
Okay, any questions? We will be voting on the emergency appropriation ordinance for 2023 for the cleanup. All in favor? Aye. Any opposed? Okay. Do you have anything else?
I don't have anything to present for information, but we do have something in other business that's significant.
Great. Okay, so under other business and communication, number 5, our next meeting is Thursday, April 4th, and B is the mobile bus tour. So I don't know if it's you or you. It's Ms. McKnight.
So our health department mobile unit is here outside, so please do join us for a quick tour of the bus.
Right now? Oh, cool.
Yeah,
I've seen it. I've seen it, so, you know. You adjourn? But then I'll let anyone come with us that wants to come. Okay. Then you can just leave after. Okay. All right, so anybody have anything else? With that, we will adjourn, and if anybody would like to go see the mobile bus, you can go downstairs and see it. Thank you.